Hey guys, my name is Roxette. Thank you for joining me on my new YouTube channel, and the content on my videos are mostly going to be about life as a foreigner in Europe, especially in Germany. I'm going to give you guys ideas and the experiences I have as a foreigner, mostly about looking for jobs, when you're going to the city hall to register, because Germany is all about registration and a lot of paperwork, and if you don't have that, you can have a really difficult time starting your life in Germany. So that is just some of the things I'll be showing you guys, but today I want to concentrate more on my motherhood, and I'm a mother of twins, two beautiful girls who are about 18 months old right now. And I want to take you guys to the journey of my pregnancy until now. Um, when I was pregnant, I worked until my second trimester, and then I started having complications because of the babies. They were twins, so mostly when you're pregnant with twins, there are most probably going to be complications. So in my second trimester, I had complications, and my gynecologist ordered me to have a complete bed rest. And that is when I started to learn the benefits of being pregnant in Germany, because I started imagining some things that happen here that actually don't happen in the country where I come from. So I'm going to express more on the insurance cover, because even if you're insured in Germany, but if you have no idea everything that your insurance covers, you're going to lose because you're already paying for it. So that is what I'm going to do with you guys today. The insurance cover covers a lot of things. That is why you need to know what kind of pregnancy do you have. Are you pregnant with one child or multiples? The moment you're pregnant with multiples, it's like a jackpot. Like, you don't have to pay for anything. So in my case, my insurance covered all my iron supplements, my magnesium supplements, the folic acid medication. That was all covered by the insurance. And then usually when you're just pregnant with one baby, there are scans that are done every 3 months, but since I was having two, I had scans every 2 weeks, every other 2 weeks. And after I got complication, it was every week. I had to go to the doctor every week. So that kind of gave me some peace of mind, even though I should be worried. Usually when you're in Africa, you can be worried because you don't know, are my children safe or not? But because I was here and the doctors gave me the assurance that my babies are fine, and then you have the chance that you can go to the doctor every 2 weeks or every week, and if you have a problem, you can go immediately, even to the hospital. And in Germany, when you're pregnant, you get a booklet. In this booklet, it entails all your details, your name, which blood group you have, what kind of pregnancy you have, how far in your pregnancy, so that in case you're on holiday or having a trip far away from home and something happens, you can go to the nearest hospital and they'll just continue doing what your doctor already does, because all the details are on the booklet. So my insurance, apart from paying for my medication and all these scans and checkups that my gynecologist did, they also told me about midwife support. A midwife, in my mind, I used to know that a midwife only comes to your aid after birth, but that's wrong. A midwife can come even before you give birth. Mostly, they will help you with weight control, because most people during their pregnancy, they can lose weight. Because in my case, I drastically lost a lot of weight because I couldn't eat. I just threw up all the time. So they can help you, give you supplements, tell you on what to eat, what to do to make you feel better, to make you have a peaceful pregnancy. So apart from this midwife support on telling me about the pregnancy and what to eat, they can also help you. Sometimes most African women get swollen feet. I saw it, I didn't see it often with the German women or the white women, but African women get a lot of swollen feet, and they can help you. You just need to go to their praxis, or if you can't, they come to you at your home. You get feet massage, you get the back aches, gymnastics that helps you to breathe and relax and just feel at ease. Apart from that, the midwife also helps you with the birth process. They can tell you, okay, where do you want to give birth? Do you want to give birth in your home, or do you prefer going to the hospital, or would you like to go to a birth house? So those are also options that you need to know. Many people prefer to go to the hospital because, you know, when you're in the hospital, everything is taken care of. I think if I had one child, I'd have loved to have a birth home, but it was not possible. So on my case, I gave birth at 38 weeks, and on that 38 weeks, I stayed at the hospital for 3 days. And then when I got back home, my midwife that was supporting me throughout the whole pregnancy journey came back at home with me. And she doesn't stay there, but she comes daily or even twice per day. And you guys, you need to know that the insurance covers all that cost, but you need to know, if you don't know, no one will come to help you. So my midwife came once per day, and if she comes, first of all, she takes care of the babies. She will show you, as a first-time mama, I didn't know a lot of things, so she will help you how to clean the baby, how to check on the wounds if the baby is hurt maybe during the birth process, how to control the baby weight, helping you with breastfeeding, because if you have two babies, it's not the same as having one baby. So she will tell me all the techniques possible on breastfeeding, like one baby on this side, the other baby on that side, or if the other baby is not hungry, you can start with one baby. So there's a lot of techniques that one can learn with the midwife. So I really enjoyed that. And the midwife support can go up to 3 months, or if you have problems, it can even take longer. You just need to call your insurance and ask if it is possible. So yes, like I said, apart from taking care of the baby, she will also take care of your wounds. Look at your wounds, your operation wounds. Is everything okay? Is everything healing as it's supposed to be? Yes, so that is also what the midwife does. Another thing that, another advantage of being in Germany, I don't know how it is in other African countries, but there's something called Mutterschaftsgeld, and it's almost translated to English as maternity allowance. Maternity allowance is what you get 6 weeks before giving birth and 8 weeks after giving birth. So altogether it will be 14 weeks. A maternity allowance is the money that you get when you can't work. This is the period when you're preparing to give birth to your baby, and after giving birth, so 3 months after giving birth, you can still stay at home, relax, without having the stress of wanting to go back to work. And this maternity allowance, mostly you get it only when you are employed before. So if you're not employed before, then I think there is a amount that the insurance gives you, but it is only once. You just get it once and then it's over. So for all those women who are employed or who have been employed before, you have the right of maternity allowance. And then there's something called Elterngeld, and Elterngeld is like parental allowance. This is now the paternity leave, where you stay at home for 1 year or 2 years, depending on how you want, or depending on the support you have at home. So in my case, I am alone here in Germany, no family around, so I really needed to stay at least 2 years at home. So like right now, I'm still on my paternity leave, and I applied for the 2-year paternity allowance. That means that instead of getting the 1-year allowance, they have divided what I could have gotten for the whole year into 2, so I get my paternity allowance for 2 years. So after these 2 years, that's when I can decide, okay, now I need to take care, to bring my children to childcare so that I can go back to work, because this money, you only get it for 2 years. So guys, I'm going to stop at that for now because there's too much. The list is long. I can't finish all that today. Let me know what you guys think. If you have any questions, you just go to the comments down there. Let me know what you guys think. You can ask questions. You can also tell me more about your pregnancy journeys or what experiences you guys made, and I'll be glad to answer each one of you guys. And don't forget to subscribe on my channel. Thank you so much.